you'll not be stunned that I'm going to ask you about health care first. You indicated there, and you've indicated publicly quite clearly, that the rollout has been difficult. What do you think you've learned from this experience about the government's ability to do this sort of thing, about the law itself, or about your own administration?
Well, there are a couple of things. Number one is that this has been a big problem for a very long time, and so it was always going to be challenging not just to pass a law but also to implement it. There's a reason why, despite a century of talking about it, nobody had been able to successfully try to deal with some of the underlying problems in the healthcare system. The good news is that many of the elements of the Affordable Care Act are already in place and are working exactly the way they're supposed to. So making sure that consumers who have employer-based health insurance are getting a better deal and that are protected from some of the fine print that left them in the lurch when they actually got sick. That's in place. Making sure that young people under the age of 26 can stay on their parents' plan. That's helped 3 million children already. That's making a difference. Helping seniors to get better prescription drug prices. That's already helped millions of seniors and billions of dollars in savings. Rebates for people who see insurance companies who are not spending enough on actual care, more on administrative costs or profits. They're getting rebates. They may not know it's the Affordable Care Act that's giving them rebates, but it's happening. So there were a number of things that were already in place over the last 3 years that got implemented effectively. The other thing that hasn't been talked about a lot is cost. There was a lot of skepticism when we passed the Affordable Care Act that we were going to be giving a lot of people care, but we weren't doing anything about the underlying costs. And in fact, over the last 3 years, we have seen health care costs grow at the slowest pace in 50 years. And that affects the bottom lines of everybody here. And there are a lot of smart delivery system reforms that slowly across the system are being implemented, and they're making a big difference. And that's saving us money. That's why, by the way, some of the projections that in terms of what the Affordable Care Act would do to deficits have actually proved even better than we had originally expected. What I have learned, though, with respect to setting up these marketplaces, which are essentially mechanisms where people who are currently in the individual market or don't have health insurance at all can join together, shop, and insurance companies will compete for their business. Setting those things up is very challenging just mechanically. The good news is that choice and competition has actually worked, and insurers came in with bids that were even lower than people expected, about 16% lower than had originally been projected. The challenge has been just making sure that consumers are actually able to get on a website, see those choices, and shop. And I think that we probably underestimated the complexities of building out a website that needed to work the way it should. There is a larger problem that I probably, speak personally, but also as the administration, could have identified earlier, and that is the way the federal government does procurement and does IT is just generally not very efficient. In fact, there's probably no bigger gap between the private sector and the public sector than IT. And we've seen that in, for example, the VA and the Department of Defense trying to deal with electronic medical records for our servicemen as they move into civilian life. Most of that stuff's still done on paper. We've spent billions of dollars. I'm not saying we as in my administration. I mean, we've now had about a decade of experimentation, spent billions of dollars, and it's still not working the way it should. So what we probably needed to do on the front end was to blow up how we procure for IT, especially on a system this complicated. We did not do that successfully. Now, we are getting it fixed, but it would have been better to do it on the front end rather than the back end. And the last point I'll make is that in terms of expectation setting,
Yeah.
there's no doubt that in an environment in which we had to fight tooth and nail to get this passed, it ended up being passed on a partisan basis, not for lack of trying, because I met with an awful lot of Republicans to try to get them to go along, but because there was just ideological resistance to the idea of dealing with the uninsured and people with pre-existing conditions. Yeah, there was a price to that, and it was that what was already going to be hard was operating within a very difficult political environment, and we should have anticipated that that would create a rockier rollout than if Democrats and Republicans were both invested in success. One of the problems we've had is one side of Capitol Hill is invested in failure, and that makes, I think, the kind of iterative process of fixing glitches as they come up and fine-tuning the law more challenging. But I'm optimistic that we can get it fixed.
Well, that's the question I was going to ask next. Is it possible you've lost enough time here and enough potential customers in the exchanges that you're not going to reach the critical mass of sign-ups that you need to make the marketplace work? Is that a danger that you have to worry about right now?
Well, it's something that we have to pay attention to. But keep in mind that this model of marketplaces was based on what was done in Massachusetts. And the experience in Massachusetts was that in the first month, 153 or 63 people signed up out of an ultimate 36,000. It was less than 1% signed up in that first month, partly because buying insurance is a complicated process for a lot of people. When they have more choices, it means that they're going to take more time. There's no doubt that we've lost some time, but the website's getting better each week. By the end of this month, it will be functioning for the majority of people who are using it. They'll be able to shop, see what their choices are. The prices are good. The prices are not changing during the open enrollment period that goes out until March. And so I think that we're going to have time to catch up. What's also been expressed as a concern is the mix of people that sign up. So we might end up having millions of people sign up. They're happy with their new coverage, but we've got more people who are older, more likely to get sick than younger,
right, and
healthier. We've got to monitor that carefully. We always anticipated, though, that younger folks would be the last folks in, just because it's been a while since you and I were young, but as I recall, you don't think that you're going to get sick at that time. So, look, I am confident that the model that we've built, which works off of the existing private insurance system, is one that will succeed. We are going to have to, A, fix the website so everybody feels confident about that. We're going to have to obviously remarket and rebrand, and that will be challenging in this political environment. But keep in mind, in the first month, we also had 12 million people visit the site. Yeah. The demand is there. There are 41 million people who have don't have health insurance. The folks in the individual market, many of them are going to get a much better deal in the marketplaces. And so we've just got to keep on improving the customer experience and make sure that we're fending off efforts not to fix the problem, because if somebody wants to help us fix it, I'm all game, but fending off efforts to completely undermine it.